Asthma is the most common chronic condition among American children. 1 in every 10 kids suffers from the coughing and wheezing and difficulty breathing. Today we're going to ask Dr. Jenny Wilkins from Age Vital Pharmacy if there's anything we can do to prevent asthma and what are the best ways to treat it. Dr. Jenny, it's scary when you see a kid wheezing and coughing and they can't get their breath, or an adult.
Yeah, it is scary.
What can you do for that?
Well, there's so many different things that you can test for. Number one, it's all linked to nutritional deficiencies, as opposed to, you know, taking all of these asthmatic, the albuterol inhaler, the Advair inhaler, that, you know, they're bronchodilators, so they expand the chest, but they have side effects that go along with it. So you're degenerating bone, you're compromising the immune system, and then you're also, and that's the last thing somebody with an asthma attack wants to do, is to take a steroid and then weaken their immune system further, and then it makes it into a more chronic condition, and then you'll see that happen more and more, and then kids with asthma end up having more types of allergies. They're allergic to different types of foods. They no longer, you know, they lose their sense of smell or their sense of taste, and it's just really bad. So what I do, especially with my immunologists, my allergists, my doctors, ENTs, those are the most popular referrals I get, you know, allergy patients from. I like to test them to see what specific deficiencies they have. And it's always a deficiency in some vitamin or antioxidant. So my most popular products, you know, asthma types, I guess we can talk about the different types of asthma.
It's not all,
because people just think
wheezing
and stuff like that. Right. So different people have different symptoms for allergic reaction. So an allergic intrinsic asthma. So that's the kind where, you know, you have the dog, the dust, and then you have the non-allergic intrinsic asthma, so air, pollution, just like scents, perfumes. Like, I'm very sensitive to perfumes. Somebody wears
Linda has that trouble.
Yeah, I can't. Like, I do too. My eyes water and my nose sniffles, and my husband starts laughing at me. But there's different types of environmental asthma. So when you're allergic to different types of trees, and then food, different types of asthma. And asthma doesn't mean you're just wheezing. You could even have like a dry cough. If you see someone that just has this cough all the time and they're like, that's a form of asthma. That's usually your body saying, okay, we're getting kind of close there, and then it could lead to that chronic asthma with the wheezing, and then you have to have some assistance.
So your tests show you what you need to treat it with?
Yeah, what deficiency. We're looking specifically, you know, for lung pathways to see, you know, if your filters in your lungs are, you know, working properly. So my most popular, you know, deficiencies are CoQ10, and I have a product called CoQ10 Plus, and it's a 300 milligram, but CoQ10 is an antioxidant. It's one of the most powerful antioxidants, but it really helps rejuvenate different types of lung tissue. And then I have another product called CARDIOFIT. CARDIOFIT is vitamin D with K2 in it. Vitamin D is really good for the immune system, and I think everybody in our society is deficient in vitamin D. Usually their bones hurt, and then you'll start seeing someone get a cough when they have a deficiency in vitamin D. And the moment I give them a shot of vitamin D or a capsule of vitamin D, their cough goes away. People, when they're getting sick, they come to me too when they have the asthma from having a cold. And then I have another product called Metabolic Immune. It's a powder. So when you're thinking of lung health, it's all antioxidants. You want to support your system by taking antioxidants. Vitamin A, vitamin E, vitamin C, things like that. So those are, and then, NAC, N-acetylcysteine. Huge. That's probably the #1 deficiency for asthma patients. And acetylcysteine helps you rejuvenate the lining of the lungs. So think of the lungs as filters, and as you're using your lungs more, those filters start to disappear. Can you imagine not cleaning the filters in your house? So you're going to think of your lungs the same way.
Concept.
So that NAC
makes sense.
Flushes all of those toxins off your lungs.
You don't have to be.
So you don't have to have an inhaler.
You're
giving your body exactly what it needs, as opposed to just, here's your Band-Aid for your boo-boo. You know, come back in 6 weeks, little children. You know, get another med.
Thank you so much, Dr. Jenny.
Thank you.
You can go see her at Age Vital Pharmacy in downtown Sarasota, or you can go online for more information to agevital.com. Thank you so much, Dr. Jenny. And here comes the bride. We're going to have a bridal fashion show next.
Yay.